Good evening and welcome to the 2021 Mental Health News Education Virtual Leadership Award reception. Can you believe this is our 8th reception? But it's our first virtual event. My name is Debbie Panton and I am the board chair of Mental Health News Education as well as the president and CEO of Outreach. Thank you all for taking the time out of your busy schedules to be here with us tonight. We would usually be together at the NYU Kimmel Center. Canceling our event last year due to COVID was difficult, but a necessary decision. And we are so fortunate to have such a wonderful network of individuals and organizations who have provided much needed financial support for our award-winning publications. I come before you tonight with the strength and the support of 13 additional board members and David and Ira Minot, who publish the publications. Our publications reach an audience of over 200,000 readers here in New York and across the country, and these numbers continue to grow each year. This annual Leadership Award reception is now firmly established as a great tradition, gathering leaders like yourselves from the behavioral health and autism communities. We are all hopeful that we can be together in person next year, networking and catching up with colleagues that you may only see once a year at our event. I would like to thank both our first-time visitors and those of you who have been coming year after year for your wonderful support. If there is one thing that COVID has taught us, is the importance of planning and pivoting to meet the current need. We have taken the opportunity to plan for the future. And with that, I would like to congratulate David Minot for stepping into the role of Executive Director as the new face of Mental Health News Education, while Ira Minot, whom you all know, remains on board with us as a founder and publisher of Behavioral Health News. David will lead MHNE in a new direction with a focus on web-based content delivery and the development of new partnerships to collaborate on exciting new projects. If you are interested in working together with us, please make sure to get in contact with David. We, of course, most grateful to this year's exceptional and especially deserving honorees, and that's our stars for this evening, whom you'll be hearing from as we begin our program in just a few moments.
Marco Damiani, Chief Executive Officer of AHRC New York City, receiving the Excellence in Autism Award. Tony Hannigan, Past President and CEO of the Center for Urban Community Services, receiving the Lifetime Achievement Award. Dr. Hilary Kunins, Past Executive Deputy Commissioner of Mental Hygiene of the New York City Department of Health and Mental Hygiene, receiving the Healthcare Hero Award. Allison Sesso, Executive Director of RIP Medical Debt, receiving the Behavioral Health Advocacy Award. And Dr. Ian Shaffer, former Vice President and Executive Medical Director at Health First Behavioral Health, receiving the Corporate Leadership Award.
We would also like to thank our honored sponsors for this evening.
Our diamond sponsor, AHRC New York City. Our gold level sponsors, the Center for Urban Community Services and Health Management Associates. And our silver sponsors, Allure Specialty Pharmacy, Coordinated Behavioral Care, Health First, RIP Medical Debt, People's United Advisors, Shufro Rose, and Unique People Services.
Once again, we wish to thank the Mental Health News Education Board of Directors for your unwavering dedication and leadership. Together, we make a great team, and I am so proud to be your board chair. And of course, we must applaud Ira and David Minot. We would certainly not be here this evening if not for your extraordinary efforts. On behalf of the MHNE Board of Directors, I cannot thank you enough for all that you continue to do to steer this wonderful organization, providing an essential resource for the autism and behavioral health communities. Once again, a warm welcome to you all, and thank you for your ongoing support. Enjoy tonight's celebration.
What makes us different is that mental health news education provides a trusted resource of education and information and quality resources in the community. And Autism Spectrum News has an editorial board that serves to ensure all content in each issue is proven effective information that is backed by science.
The need for behavioral health news and autism spectrum news can't be understated. Education about these issues, mental illness, substance use disorders, autism, the educational piece of the puzzle really is the cornerstone of the systems that are in place.
The trusted source of information that really spreads things that are working, things that have been being tried, things that aren't working across the sector, and helps again make those institutions stronger and also again that sense of community, which is really important.
And the Fountain House is a longtime supporter of the mental health news and the good work it's done. The autism one I wanted to say is I was really pleased when that came out. I have been approached over the years many times by family members of people with autism.
It's evidence-based information that's easy to understand. There are people that are in your field or you can contact and get more information from. So it really is, it's an applied publication.
It's an entity that allows everyone to look and gain understanding and see other perspectives.
Try to identify funding that the newspaper can go about identifying to continue to grow the readership.
I would really like to see us continue our presence as a strong media outlet that provides this vital information, as well as provide a forum for discussion about autism, mental health illness, and substance use disorders.
That's what we're doing. We're reporting the good news about mental health and the good news about autism and substance use disorders and giving people a voice.
Support mental health news education, your trusted source.
Support mental health news education, your trusted source. Good evening. My name is Ira Minot, and I'm the founder of Mental Health News Education, or MHNE as we call it. We're the nonprofit organization that publishes behavioral health news and autism spectrum news. I'd like to start by sharing my personal story that led to the creation of MHNE. MHNE began in the late 1990s on the kitchen table of my small supported housing apartment following a horrific 10-year battle with major depression. I learned a great deal about the good and the not so good aspects of our mental health system as a consumer of mental health services during those 10 difficult years. I had firsthand experience with outpatient and inpatient treatment and hundreds of individual therapy appointments. Outside of direct treatment, I experienced the generosity and care provided to me to me by community service organizations who enrolled me in Social Security disability and who provided me with shelter in supported housing. I lived through the loneliness that so many consumers experience in their small apartments, ruminating about problems which never seem to go away despite treatment efforts. When I was finally well, I realized that outside of the few hours we spent in day treatment, we continued to return to our same lonely apartments. Even though there were some educational and recovery services available to us like NAMI, MHNE, and new consumer-run clubhouses that were sprouting up in the community, we had little way of knowing about them. In other words, nobody was reaching out to us where we lived. I set out to change that. After reading the report compiled by then Surgeon General David Satcher, which stated that education was one of the cornerstones of mental health recovery, my vision was to start an educational publication that would send a message of hope to consumers and families everywhere. Taking the first step, I compiled a list of leaders of the mental health community in the New York region and set out to meet them. I was amazed at how receptive they all were and how they appreciated me telling them the story of my journey in recovery. I told them I wanted to tell the good news about the mental health community and how organizations like theirs were quietly saving lives every day. And so, 21 years ago, we premiered our first publication called Mental Health News, which has since been rebranded to Behavioral Health News to include the coverage of substance use disorders. As we look towards the next 20 years with determination and excitement, I am very pleased to announce that my son David has stepped into the role of executive director, while I remain with the organization as founder and publisher of Behavioral Health News. While we're still just a staff of 2, supported by our dedicated board of directors, our impact and reach continues to grow every year. I welcome you to visit behavioralhealthnews.org and autismspectrumnews.org, where you will find our new websites with over 1,000 articles each in an easy-to-access format. Please also join our social media community, where we provide a trusted source of autism and behavioral health information, education, and resources. Thank you to tonight's event sponsors. Your support is critical to our small nonprofit organization. I would also like to thank the Behavioral Health News Honor Roll of publication sponsors, which include our gold sponsors, ICL and Well Life Network, and our silver sponsors, the New York Psychotherapy and Counseling Center and Services for the Underserved. In addition, I want to thank the individuals and organizations who contribute articles and advertise in our 2 publications. Your participation and support help MHNE continue our mission of educating the community about autism, mental illness, and substance use disorders. And finally, I want to recognize our fantastic board members who have served as our mentors and our guiding force. In our minds, the future looks bright, and the best is yet to come. Thank you for your attendance this evening and your support, and enjoy this evening's program.
Good evening, and thank you for joining me at the beautiful NYU Kimmel Center, where we typically hold our in-person events. My name is David Minot, and I am honored to be the Executive Director at Mental Health News Education, a title I have recently assumed after previously serving as Associate Director and Publisher of Autism Spectrum News for the past 14 years. For more than 20 years, Mental Health News and its successor Behavioral Health News have been your trusted source for education, information, innovations, and policy issues on mental health and substance use disorders. and since the launch of Autism Spectrum News in 2008, we have been providing the autism community with science-based information that separates hearsay and conjecture from the latest developments in the field. MHNE also plays a vital role in connecting treatment professionals and providers to individuals and families in the community. Our readership continues to grow as our content has become more accessible online. Our recently updated websites, autismspectrumnews.org and behavioralhealthnews.org, provide our readers with unlimited access to over 2,200 educational and informative articles online. In addition, we post content almost daily that speaks to our 30,000 social media followers across Twitter, Facebook, LinkedIn, and Instagram for both publications. We recently launched our new Update newsletters to share bite-sized portions of our content for readers on a bi-weekly basis. We use these newsletter updates to provide information on the quality resources and organizations that partner with us in providing services and support to the autism, mental health, and addiction communities. If you aren't receiving these emails, you can sign up on our websites. Like so many of the nonprofits that we partner with, we too have been hit hard financially due to the COVID-19 pandemic and have had to reevaluate our business practices. But out of adversity, MHNE has grown stronger. Having just recently completed our latest round of strategic planning, we are equipped with a 3-year plan that will enable us to better meet the needs of our readership while focusing on sustainability and growth to usher us into the future. In response to feedback from our stakeholders and readers, beginning with the upcoming summer 2021 issues of Behavioral Health News and Autism Spectrum News, we will be transitioning away from print to an all web-based format. This new digital strategy will allow us to become more adept in communicating timely issues of importance, such as the impact of COVID-19 on families and consumers, new service delivery models in the age of telehealth, vaccine hesitancy, and the latest developments and government initiatives. Now more than ever, the mental health, substance use disorder, and autism communities need accurate information to help guide families and individuals in understanding the impact of the pandemic and how they can access resources in the community. Partnerships and collaborations have always been a mainstay of our organization. We look forward to building on these with the addition of webinars and roundtable discussions that will educate and unite our readers, connect families and individuals with the services they need, connect professionals with one another, and bridge the divide between the autism, mental health, and substance use disorder communities. We are excited to develop these new ventures to deepen and expand our mission. While I would rather be speaking with you in person, we are truly fortunate to have the opportunity to hold this year's event virtually. I sincerely thank each individual and organization that has supported tonight's event, made donations to our emergency COVID-19 appeal, and contributed publications with article submissions and advertising throughout the year. Special thanks to our diamond sponsor, AHRC New York City, and our gold sponsors, the Center for Urban Community Services and Health Management Associates. I also want to personally thank everybody watching who works directly with individuals and consumers living with autism, mental illness, and addiction issues for your dedication and service over the past year during COVID. Tonight, you still have an opportunity to support autism and behavioral health education with a donation or by purchasing 50/50 raffle tickets for only $20 each. Our 50/50 raffle is now at over $1,000, and you still have a chance to win. We will be holding the drawing on Wednesday, May 19th. Any additional support you can provide helps, and we thank you for your generosity. To purchase your tickets or make a donation, please visit behavioralhealthnews.org/donate. Also, I would like to invite you to take a moment to view this year's wonderful event journal, which you can access through the link in the description below or by visiting behavioralhealthnews.org/awards. At this time, I'd like to ask you all to join me in raising our virtual glasses to toast our honorees for tonight: Marco Damiani, Tony Hannigan, Dr. Hillary Kunins, Allison Sesso, and Dr. Ian Shaffer, for their incredible contributions to our communities and their dedication to making a difference in people's lives. Once again, I want to thank you for being here with us tonight. All of us at MHNE eagerly anticipate next year when we can hopefully be again together in person, here at the beautiful NYU Kimmel Center for a night of celebration. We hope you enjoy the rest of tonight's program.
Hi, I'm Dr. Ann Sullivan, your Commissioner for the New York State Office of Mental Health, and it is a pleasure to be with you all this evening to celebrate the Leadership Awards of Mental Health News Education. I would first like to thank Ira and David Minot for all you have done over 20 years of publications for behavioral health news. You have really provided an excellent forum for unbiased, great educational material for providers of care, for clients, for their families. Thank you for all the hard work and the excellent journalism. You've covered topics that have included things like social determinants of health, integrated care, the suicide epidemic, the opioid epidemic, a work on workforce, and also the services that we provide to families, youth, and adults. So thank you so much for all you've done all these years, and continue to do great work. I would also like to congratulate and thank our wonderful honorees this evening. Each of you has done such great work over this past year during this very difficult pandemic and for many years before. So thank you for all that you have done. A special thank you to Dr. Ian Shaffer, to Dr. Hilary Kunins, to Mark Damiani, to Elizabeth Sesso, and of course to Tony Hannigan. So thank you all for what you have done and for your contributions to all New Yorkers. So once again, I hope you all have a wonderful evening. Thank you, and all the best.
Good evening. I am Arlene Gonzalez-Sanchez, Commissioner of the New York State Office of Addiction Services and Support, also known as OASIS. It's a pleasure to join Mental Health News and its Board of Directors on this virtual Leadership Awards reception. Thank you for inviting me and allowing me to be part of this very special evening. I would like to commend Mental Health News and the board for providing vital education dedicated to the well-being of the autism and behavioral health communities. Tonight, we are honoring 5 outstanding leaders. I congratulate each of you on your demonstrated and unrelenting commitment to improving the overall health and wellness of our fellow New Yorkers, especially during these trying times. You are truly making a difference in people's lives. As we all know, it has been a challenge during the time of the COVID-19. It's been a challenge for our nation, for our state, and our communities. The impact of the pandemic has reminded us of our strengths and resilience. I would like to take a moment to also acknowledge our frontline staff workers who have selflessly put themselves in harm's way to ensure that New Yorkers get the services they so desperately need. Your strength and commitment are the driving force that keeps us all moving forward. You are our heroes and an inspiration to us all. Together, along with many of you here, we have worked to ensure that we continue on our mission to enhancing and improving the lives of New Yorkers. Thank you for all you do. So once again, I would like to offer my congratulations to all the honorees, and thank you to Mental Health News for inviting me to be part of this great event this evening. Thank you.
Hi, I'm soprano Donata Cucinata. It is so wonderful to virtually see everyone who has joined with us tonight as the autism and behavioral health communities unite together in celebration of our inspiring panel of honorees. I have a personal connection to mental health news education as someone with a brother on the autism spectrum and a mother who worked in school psychology. And I truly appreciate the work that MHNE is doing to change lives through education. I support mental health news education, your trusted source. Thank you so much.
What a wonderful world.
HRC is among New York's leading champions for equity and social justice for people with disabilities. Spreading the power of our conviction, our professionalism, and with a dedicated workforce of 5,000, we find ways for people with IDD to build full lives. Our mission is more urgent than ever. We face complex challenges that require strong team-based work. We must create durable solutions for a bright future. A year ago, we faced a global pandemic with New York City at its epicenter. We had a lot to lose. We did all we could to stem the impact of the pandemic. We suffered unbearable losses, both the people we support and our staff. We mourn those losses as well as the losses of those suffered by our many colleague agencies. We made it through the springtime having learned many lessons, such as the power of data-driven decision-making and the enormous impact of working together as a team. We must envision the future and drive new ways of thinking. I'm real proud of the work we do at AHRC New York City, but we're never going to rest on our laurels. We'll always look to do better and exceed expectations. I suspect that many of you feel the same way. So let's work together so we can be stronger together. Let's help shape policies that truly matter and ensure that we develop enduring solutions that take advantage of the historical federal programs that are unfolding before us. Let's seize opportunities to achieve this vision. Let's build the best possible care and support infrastructure for people with IDD, our workforce, our communities, and our organizations. Thank you.
Our first honoree of the night is Marco Damiani, Chief Executive Officer of AHRC New York City, who has been awarded the Excellence in Autism Award for his excellence in caring for people with intellectual and developmental disabilities, behavioral health, and primary care throughout New York City and New York State. Marco joined AHRC New York City with a varied and progressive career in the field of intellectual and developmental disabilities, behavioral health, and general health care as a clinician, consultant, and agency executive. Marco's career began at FEGS as a direct support professional and clinician shortly after the implementation of the landmark Willowbrook Consent Decree, and progressed throughout the years with positions in New York State government to executive vice president at YAI Network, where he led a broad and expansive portfolio of health and behavioral health care, research and program evaluation, and a large community-based support, information, and referral program, to Executive Vice President at Cerebral Palsy Associations of New York State, to his most previous position as CEO of Metro Community Health Centers, a network of 5 federally qualified health centers in New York City devoted to supporting patients of all abilities. Marco attributes his success to the extraordinary collective work and shared vision of his many colleagues over the years, their enduring commitment to promoting social justice for people with disabilities, and his never-ending quest to being more than just a so-so guitar player. Accepting the Excellence in Autism Award, I am pleased to introduce Marco Damiani.
At AHRC New York City, I lead a workforce of over 5,000 really committed staff. They work every day to empower people with disabilities to have a full life. We work really hard to get people engaged in community activities, and very importantly, we treat the work we do as a social justice imperative. It's really important that we recognize that New York City is an incredibly diverse tapestry of human beings, and people with disabilities are an integral part of that. I started my career right out of college. I actually spent about a year and a half working at Willowbrook State School, not as a state employee, but as a nonprofit employee, and it was a mind-opening experience. To this day, I still can smell the units at Willowbrook, but it was a great lesson learned. At that time, the innovation was taking people off an institution's grounds and having them come into Greenwich Village and walk the streets of Greenwich Village. That was an innovation then. Now it's just completely expected. And I was fortunate to work with great people along the way. I went back to graduate school in psychology and worked for government for a while, and really got very interested as I got back into the nonprofit space in finding ways to integrate healthcare, behavioral health, and social services into a system of care and support that was unique and that really treated the whole person. It's easy to talk about that, but to really get true systems change, you need great teams, you need really great thinkers, you need creative funding models, and you need to have a passion for treating somebody as who they are, one person. I often say that, as crazy as it sounds, if someone gets 5 different services in an organization, they're not 5 different people, they're one person. So for me, what's really driving my career has really been a whole person model. And I've been fortunate to work for a number of years in the healthcare space as well. So I kind of see the great value good healthcare can bring, but the great challenges in integrating with the healthcare and behavioral health system for people with intellectual and developmental disabilities. The most satisfying part of my job is to really work with people every day who have a passion for social change. It's really important that we do day-to-day work and get people more integrated, learning new things, feeling good about their lives. But what's really the most exciting thing for me is to ensure that they're totally included in society, that it's not just going through the motions, that their skills and their special attributes are really recognized and are integrated into the day-to-day life of New York City. This is really a social justice action that we're involved in. I think what sets mental health news education apart is that it really occupies a very unique space between academic journals, scientific articles, which have great value for this field, but also you see these feel-good stories, which are nice, they're on TV or they're in magazines, but the space that you're occupying is a combination of the two. It's evidence-based information that's easy to understand. There are people that are in your field or you can contact and get more information from. So it really is, it's an applied publication, something you can learn from, your colleagues can learn from. If you have a family member you're working with, you can really take the information and give them a better life. I think it's a really unique space that's being occupied by mental health news education. My name is Marco Damiani. I support mental health news education, your trusted source.
Our next honoree is Tony Hannigan, founder and past president and CEO of the Center for Urban Community Services, who has been awarded the Lifetime Achievement Award for his lifetime of dedication to help New Yorkers rise from poverty, access critical housing, foster wellness, and confront head-on the homeless crisis for the most vulnerable populations. From 1983 to 1993, Tony was responsible for the growth of CUCS, an interdisciplinary project that developed various neighborhood-based programs for homeless and low-income individuals. Tony is a licensed social worker and was a staff member of the Manhattan Borough President's Office and later the New York State Office of Mental Health. In 1993, Tony led the spin-off of CUCS from Columbia University. With an annual budget that exceeds $80 million, CUCS currently works with 50,000 individuals through its housing, psychiatric, medical, and social services programs in New York as well as its National Staff Training Institute. Tony has co-authored numerous professional articles and is a board member of Homeless Services United, Coordinated Behavioral Care, and the Supported Housing Network of New York. In addition, he is a member of the New York City Human Services Strategy Council and has chaired various mayoral and gubernatorial select committees on homelessness. Accepting the Lifetime Achievement Award, please welcome Tony Hannigan.
As the director of CUCS, I was ultimately responsible for all aspects of the organization's finances, operations, and performance. I have countless fond memories of working at CUCS. Seeing homeless individuals go from bedraggled on the street to having an apartment of one's own is priceless. Being part of an organization that has developed significant numbers of affordable housing and supportive housing buildings means watching individuals and families by the hundreds move into a place of their own. I think the most rewarding and satisfying part of a CEO's job is building an organization that is effective. CUCS's impact is felt nationwide through its substantial staff training program, and here at home in New York City, it is reaching people who have been marginalized by homelessness and behavioral issues, and helping them regain stability, escape homelessness, and be healthy is extremely satisfying. My career has had many highlights. Originally, back in the early 1990s, I led a spin-off of a project at Columbia University that ultimately became the successful nonprofit that CUCS is today. Along the way, CUCS helped pioneer permanent supportive housing, exemplary shelters for homeless people suffering severe behavioral health issues, a national staff training program, and other wide-ranging services, including the first street medical program for homeless people here in New York City. COVID has required thinking about and doing most everything differently. Our staff training programs are now online. Much of our staff works remotely. We conduct telemedicine, telepsychiatry, and telesocial work and telecase management whenever necessary. Its success is a testament to our staff and the people we serve. It's said that my legacy at CUCS is having led the creation of a very strong and effective organization, and that I did that with a positive attitude and being respectful of staff and the people who are here to help. I'm very happy with that. It's an honor to be presented with the Mental Health News Education Lifetime Achievement Award, and very gratifying, of course. On the other hand, I guess it also officially means I'm getting old, but did that with some distinction. I first learned about mental health news education by being given a copy of behavioral health news from a colleague at work. Having read a few articles, I got a subscription and thereafter learned about the dedication that Ira and David have to inform everyone involved, including government, practitioners, and consumers. Health news education publications are so important because they are grounded in real-life experience, personal stories, and offer practical perspectives that are not always so available. My name is Tony Hannigan, and I support mental health news education, your trusted source.
Our next honoree is Dr. Hillary Kunins, past Executive Deputy Commissioner of Mental Hygiene at the New York City Department of Health and Mental Hygiene, who has been awarded the Healthcare Hero Award for her steadfast commitment to elevating public health solutions for all New Yorkers impacted by behavioral health and social determinations of health conditions, and for being a beacon of clarity and consistency, especially during the COVID-19 pandemic, as a true government health partner to the field of behavioral health services. Dr. Kunins led New York City's public health strategic and equity-driven initiatives to improve the behavioral health of all New Yorkers, including for children, adults, and people affected by criminal justice involvement experiencing homelessness, developmental challenges, or addiction. In her prior role as the DOHMH Assistant Commissioner for the Bureau of Alcohol or Drug Use, Dr. Kunins led the reimagining of New York City's public health approach to substance use, including overdose, rapidly implementing and scaling up programs in public health surveillance, naloxone distribution, peer-delivered overdose support, and buprenorphine treatment in primary care and harm reduction settings. Dr. Kunins has dedicated her career to promoting equitable health for people with substance use and other behavioral health concerns through science-based public health and healthcare programs and policies. Accepting the Healthcare Hero Award, I am honored to present to you Dr. Hillary Kunins.
This past year, COVID has affected, no doubt, all of us, every single person in this country, in our city. And working at the New York City Health Department during this period has turned our work upside down, inside out. Both from the point of view of being public health workers, we have all been the term that we use is activated in the response. We have been deployed to do a great variety of things to protect the health of New Yorkers. Everything from helping to implement contact tracing, case investigation, implement new testing sites, to track and have data about where cases were increasing and not. One thing which is obviously very important to me is I've spent many, many years working on improving the care and improving policies for people who have substance use disorders. And historically, at the health department, the mental health side of the behavioral health division has really been a dominant approach and force. And I think as so many of us are working on this issue of integrating all kinds of behavioral health care together. When I first learned that I had been selected for the Healthcare Hero Award, I was extremely honored. I know and have enormously respected behavioral health news. It's been my regular reading when it comes out and when it comes to my desk. I also know that this community is really been tracking what's been going on in New York City, advocating for better care, better services. And so to get an award acknowledging being part of that effort is been so meaningful, particularly after a year of working on the COVID pandemic, and really with myself and all of my team really working our hearts out to make sure that New Yorkers get what they need. The publications are so important because they fill a really specific role in New York City to connect people who are using services in New York City, who are providing services in New York City, with perspectives and information, and really, I think most importantly, creating a sense of community and purpose of both service providers and people using services. It's been really a wonderful connector amongst those communities. My name is Dr. Hillary Kunins, and I support mental health news education, your trusted source.
Our next honoree is Allison Sesso, Executive Director of RIP Medical Debt, who has been awarded the Behavioral Health Advocacy Award for her many years of advocacy on behalf of over 170 nonprofit human services organizations serving New York City's healthcare system. Allison became the Executive Director of RIP Medical Debt in January of 2020. Prior to joining RIP Medical Debt, Allison served as the Executive Director of the Human Services Council of New York, an association of 170 nonprofits delivering 90% of human services in New York City. Under her leadership, HSC pioneered the development of nationally recognized tools designed to eliminate risks associated with government contracts, including an RFP rater and government agency grading system. She led negotiations with New York City and state government on behalf of the sector and successfully pushed for over $500 million in investments to address the nonprofit fiscal crisis. During her tenure at HSC, Allison also led a commission of experts focused on social determinants of health and value-based payment structures and published the report Integrating Health and Human Services, a Blueprint for Partnership in Action, that examines the challenges of operationalizing relationships between health and human services providers, offering several recommendations. She also served on the New York State Department of Health's Social Determinants and Community-Based Organizations Subcommittee, helping to formulate recommendations around the integration of CBOs into Medicaid-managed care. Accepting the Behavioral Health Advocacy Award, please welcome Allison Sesso.
So we actually have a very exciting mission where we literally buy people's medical debt and absolve them of it. So obviously medical debt is a chronic problem across the United States, and so we have this great solution in which we buy bulk debt and we buy it and we get rid of it for people, and then it takes away the economic hardship. And we obviously focus on people who are have economic hardship, so it's not just for anybody, and that's what we do. So we get donations from individuals, and we're sort of angel philanthropists, if you will, and get rid of people's medical debt so that they are more economically secure. Prior to being at RIP Medical Debt, which I'm really newly at, I've only been there for a very short period of time. I started in January of 2020. I had a long career at the Human Services Council, which is an association of nonprofits working in the New York City area that provide a variety of social services and meet human needs. And I represented them to government and worked for public policies that would make them better and stronger institutions and more financially sound and able to meet community needs. I galvanized the community of providers of human services. We worked with partners effectively, and we were nonpartisan but yet political at the same time, and able to move policy change on behalf of those nonprofits so that, again, they were stronger, more financially sound institutions. And we applied a lot of political pressure, which I'm proud of, and we were able to get things like better indirect rates for nonprofits, which people think is generally a boring thing, but for a nonprofit and somebody managing a nonprofit, it is not boring in the slightest. So that is the type of work that we did, and I'm proud of what we accomplished. And I think New York City's nonprofit sector is stronger and on a course to being financially more strong as a result of the work that I did there. I accepted the award because it's always a little bit humbling to be recognized for your work, especially when you do this work, because frankly, and for me, I do this work, I don't know how not to do this work. But I accepted the award because I do recognize that when you do accomplish things and when you're an advocate, people want to recognize that, and it helps bring attention to the cause, honestly. So I'm grateful for the attention, not to me, but to the causes that I'm dedicating myself to. It was the human services sector. Now it's medical debt, but frankly, it's at the end of the day, it's the same people in the communities that I'm looking to serve. It's just sitting in a different place in which I'm going at that. I think that this publication is really important because it helps create a community. It helps foster community. I mean, look, the work of any social service, any mental health, healthcare, all of that is really hard work, and it's creating a community really helps people continue that work. It's a resource for them. It also keeps them, easily abreast of what the latest issues are, what the latest things are happening are, and so. I think that's really important and an important role of this newspaper. It's a trusted source of information that really spreads things that are working, things that have been being tried, things that aren't working across the sector, and helps, again, make those institutions stronger and also, again, that sense of community, which is really important. My name is Allison Sesso. I support Mental Health News, your trusted source.
Our final honoree of the evening is Dr. Ian Shaffer, former Vice President and Executive Medical Director at Health First Behavioral Health, who has been awarded the Corporate Leadership Award for his many years of leadership across a wide spectrum of care and policy issues for individuals, families, veterans, and the broader community. At Health First, Dr. Shaffer was responsible for behavioral health program management. He retired from this position in January of 2020 and currently provides consulting services on managing and providing behavioral health care. Prior to this, he was Vice President of Behavioral Health Program Design and Research for HealthNet Federal Services, responsible for behavioral health program design and research with a specific focus on the military and veteran populations and their families. Previously at HealthNet, Dr. Shaffer was MHN's Chief Medical Officer, responsible for setting the company's clinical policies and guidelines and ensuring clinical excellence. Dr. Shaffer oversaw MHN's quality improvement and disease management units and was accountable for the coordination and quality assurance of clinical care. Accepting the Corporate Leadership Award, it is my pleasure to introduce Dr. Ian Shaffer.
My role really involves the development of some of the new programs that are integrating care with general medicine and behavioral health care, and trying to look at some of the people with serious mental illnesses and substance use disorders that also have major medical illnesses. Get them engaged in care coordination, outpatient care, and alleviate their need to go to emergency rooms, alleviate as many inpatient hospital stays as we can, and really improve both the quality of their life and their ability to function outside. First thoughts when I was presented with the award was it felt good that people recognized that the corporate part of healthcare and managed behavioral healthcare has a value, and that the work we're doing with the provider community has meaning and it's making a difference, because that's really what we're about. It's about making things better for our members, and it's nice when folks other than yourself recognize the value. I learned about behavioral health news in the fact that some of the newsletters come to me and have been coming for a while. I read a lot of what's out there, behavioral health news, mental health news, those kinds of news journals give me the opportunity to understand what the field and the community are looking at, and it helps us understand, okay, how can we fit into that? Because the importance of a managed care organization in behavioral health is to be a part of the team, and by understanding what is out there, what people are challenged with, gives us an opportunity to meet with people and say, hey, we may have solutions to some of those pain points. The question was why people should subscribe to these newsletters. Again, I think the value is understanding as many perspectives as one can to be able to contribute to the need of people. If we're able to read and glean from the newspapers and the newsletters, what different entities, how they're coming at a situation, it gives us an opportunity to input our information and our perspective, whichever one you have, in a way that is in the language of other folks that you want to hear it. My name is Ian Shaffer, and I support Mental Health News, your trusted source.
Again, don't know where, don't know when, but I know we'll meet again some sunny day. Keep smiling through, just like you always do, till the blue skies drive the dark clouds far away. So won't you please say hello to the folks that I know? Tell them I won't be long. They'll be happy to know that as you saw me go, I was singing this song. We'll meet again, don't know where, don't know when. Some sunny day, keep smiling through, just like you always do, till the blue skies drive the dark clouds far away. We'll meet again, don't know where, don't know when. Some sunny day, we'll meet again, don't know where, don't know when, but I know we'll meet again, some sunny day.
Thank you, Donata, and congratulations again to all of tonight's honorees. Well deserved. Good evening. I'm Constance Brown Bellamy, immediate past chair and current board member of Mental Health News Education, Inc. And on behalf of all of us, I'd like to express our sincerest appreciation for your continued support. To be honest, when we first had to postpone our annual event last year, never did we imagine that we'd still be in the midst of this pandemic. But true to form, our field has shown its resilience and necessity. And each of you, through your attendance, sponsorship, and readership, have proven the necessity of Mental Health News Education, Inc. At this time, I'd like to recognize our premier donors. At Diamond, we have AHRC NYC, Gold, Center for Urban Community Services, CUCS, and Health Management Associates, and our silver sponsors, Allure Specialty Pharmacy, Coordinated Behavioral Care, Health First, RIP Medical Debt, People's United Advisors, and Unique People Services. I'd also like to take a moment to thank David and Ira for their dedication to changing lives through education, and our esteemed board members for their volunteerism and service. Thank you to all of the individuals and organizations that collaborate with us for content, and you can view current and past issues online at autismspectrumnews.org and behaviorhealthnews.org. While you're there, sign up for our bi-weekly update newsletters and consider getting social with us on Twitter, Facebook, LinkedIn, and Instagram. Lastly, we hope you'll consider extending your support with the purchase of a raffle ticket on our donate page. Raffle tickets are only $20. On behalf of all of us at Mental Health News Education, Inc., your trusted source, thank you and good night.
Support Mental Health News Education, Inc., your trusted source.
Support Mental Health News Education, 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 Inc., your trusted source.
Support Mental Health News Education, Inc., your trusted source.
Support Mental Health News Education, your trusted source.
Support Mental Health News Education, your trusted source.
I support Mental Health News Education, your trusted source.
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 Support Mental Health News Education, your trusted source.